Hello America, I'm Weasel. I'm the team leader of the Wombus Cat Survivalist Group. Today you're going to meet a unique individual. His name's Sticks, like sticks and stones will break your bones. He's our medical liaison for the Wombus Cats. He's going to go through a very quick short demonstration today about how to suture a wound in an emergency situation, like if you can't get to the hospital or anything like that. So enjoy the video.
I'm Sticks. They call me Sticks because with sticks and stones I'll break your bones. I'm the medical advisor and consultant for the Wombus Cat Survivalist Group. My talk today is about laceration kits, their assembly, their sanitation, and their use. I'll start out with the assembly of your laceration kits. There are certain basic components of a laceration kit you have to have. You have to have an outer barrier sheet, you have to have a drape sheet, you have to have some gauze on the inside of your kit, you have to have certain basic instruments. The fewest instruments you would need would be a pair of forceps, that is tweezers, and scissors. If you want to add a hemostat to it, or a short-jawed instrument called a needle holder, if you're using commercially prepared suture, you can add that. Certainly, if that's available to you, I would add that. The reason I would suggest that you make your own kits is because that way you can tailor them to your needs, equipment that you have available, and save yourself some money, because typical laceration kits cost about 150 bucks. So I've got a sample here, and I've got a fine knit linen as an outer barrier sheet. You can see I've accordion folded the outer side so when I open it, I don't disturb the contents of the inside. Inside, I have a drape sheet that's used to place over the wound. You can or cannot have a pre-cut hole made in it so you can expose the wound through that cut. You can, of course, alter that opening based on the size and the location of the wound. I've got the gauze, I've got the instruments inside. Once you've decided what you want here, you may also want to include a threaded sewing needle on a piece of cardboard with the thread here wrapped around a piece of cardboard. You could put that in if you're not going to use commercially prepared suture material like this. You can close that back up and use standard masking tape to close it, and then you can go ahead and sanitize it using a pressure cooker after that. I'm here to talk now about how to sanitize your laceration kit. Commercially prepared laceration kits usually are treated with an autoclave or through an extensive commercial management where sterility is absolutely assured in those kits. But with ours, we can reach a high degree of sanitization, perhaps sterility, that nearly rivals those of commercially prepared kits. We can do that with an autoclave, or with a pressure cooker. With a pressure cooker, you can take your prepared laceration kit, put it in a basket here, put water in the bottom of your pressure cooker, and close this up and run it for about 40 minutes, enough time for steam to permeate through the fabric of the outer portion of your kit and carry the steam and heat into the instruments to kill whatever bacteria is in there. Now, because this is a pressure cooker, it's not designed for sterilization of instruments. There is a possibility that your instruments will have some bacteria on them, but it's very unlikely. Your degree of sanitization should rival that of a lot of autoclaves. Nonetheless, you go ahead and you close that up and put your weight on the top, run it for about 40 minutes. The more laceration kits you have in your basket, the longer it'll take steam to permeate through the barriers here to get into the instruments to sanitize them. Once you run that for about 40 minutes, you'll need to let it cool. You'll let all the pressure calm down. You'll take your weight off and you'll crack the lid and you'll let it cool some. Then you can take your instruments out by grabbing the basket here. It's important not to be touching the kits at this time because they're moist. And with moisture, or if they're wet, bacteria from your hands can, with a capillary action, get pulled into the kit and reduce some of the sterility or sanitation of your kit. So if you handle them in the basket like this, you can carry them from this into a kitchen oven and bake for another 250 degrees for about another 45 minutes to drive off any residual moisture. After that, then you're free to handle them bare with your hands. In a very wilderness survival situation, you can always use your same pressure cooker, empty the remaining water out, and then use that as your heat source for driving off the moisture. Now, the use of your prepared laceration kit. I will need a volunteer so that we can have a freshly made wound. Any of you guys ready to go? Come on over here and we'll make it and we'll sew it up. Come on now. You have no cojones. Isn't anybody here going to take one for the team? Well, I guess not. Okay, well, I'll use a tissue simulant here. We'll pretend this is a wound. Okay, you've got your open laceration kit. You've got some gloves here. You need to wash the wound well. Get out all sorts of grit and debris. After that, if you've got some lidocaine you can put in there. If you don't, well, someone's going to just have to bite a stick. Okay, you put on your gloves here. Now, with my laceration kit that I've already designed here, I've already got some suture in the kit. It's already clean, and as it's gone through the sanitation process with an autoclave. And then, after this has been cleaned, this wound, we'll do a final betadine paint with that. And we'll get out our drape sheet, open that up. The hole here will expose the wound. We have the drape sheet here so the thread from the suture doesn't drag across dirty areas and carry bacteria into the wound. You take your needle holder here, you grab your suture and your pair of tweezers. You come over here and you grab just the skin, take a bite off each side, you pull it through. The goal here is to approximate the wound margins. It is not to squeeze them so tight that they ripple all up. You just want it together and let healing do its job from there. If you don't have commercially prepared suture like I have with that small curved needle, you can use a sewing needle with attached thread and grab each side and push it through and then tie it down. I would leave these sutures in, depending on the location, for about a week. Keep a close eye for any evidence of infection. If that's the case, you can always remove the suture and allow the wound to drain. Always keep in mind that other things such as steri strips and skin glue can be used in an alternative, but suturing is the most secure. God bless America. Thank you.
I hope you found this video informative on how to suture a wound in an emergency situation. Just remember, this is a last resort kind of thing, and we just showed you the basic steps of how to do that. You can do these kits for pennies on a dollar, but it takes some training to do. Always use your medical system if it's available, 911, your hospital, your urgent care. But this is a good tool to have in the chest if the grid's down, hospital's closed, you're stuck out in the wilderness, something that'll maybe save your life. Hope you enjoyed it. Be sure to follow us on Facebook and Twitter, Wampus Cat Survivalist Group.